Hi, I'm Dr. Tony Mork, author, speaker, board-certified orthopedic surgeon, endoscopic spine specialist. Today I'd like to talk about a new treatment for cervical disc herniations, the endoscopic discectomy for a cervical disc herniation. This treatment is really new, and it's also because of the increased technology of the instrumentation available. And finally, you can do something besides a fusion or disc replacement for a cervical disc herniation. Okay, let's get started.
Well, what's the problem? The problem is pressure on a nerve from a herniated disc. This results in pain, weakness, or numbness, or some combination thereof. In this picture, we can see the black arrow pointing to the disc herniation, which is putting pressure, indicated by the red, on the exiting nerve root of the cervical spine. Here we go. Here we see the actual spinal canal. There's the foraminal canal on one side, the foraminal canal the other. There's where the disc would be located, and there's where it would be pushing out into the foraminal canal against the nerve. Up on the model here, we can see exactly where the disc herniation is located and pushing out onto the exiting nerve root. There's the central canal with the spinal cord, and here we have an MRI in the same orientation. There's the disc herniation pushing against the exiting nerve root, coursing right through there. Compare that size of the foraminal canal to the width of the other one. Very narrow on the one with the herniated disc, and that's what's causing the pain. Most cervical disc herniations will get better by themselves, but if you wait for 6 to 12 weeks and nothing is getting better, then surgery is an option. There are two surgical choices. One is a decompression, which is what this presentation is all about. I would recommend starting with this. The other, which is most commonly recommended these days, is a fusion or an artificial disc. But in my opinion, that should be saved for later if there's any problems with the decompression, which there usually aren't. Do you need to fuse your neck to treat a small disc herniation? Not in my opinion. Or do you need to do a disc replacement for a disc herniation? Again, I would say it would not be my first treatment of choice, given what I'm going to show you. A fusion and disc replacement are irreversible. If you don't like the results, there aren't many options, and they both have longer-term complications, particularly adjacent disc disease. So why not just take out the herniated disc? Well, it can be done with an endoscope. The endoscopic cervical discectomy is safe and effective, performed as an outpatient. There's minimal soft tissue injury with a 3/8 to 1/2 inch incision. It treats the problem directly. There are no instability issues afterward. There's minimal alteration of the surrounding anatomy. There's no loss of motion. There's no adjacent disc disease. And really note that this system, the endoscopic system, is hermetically sealed. So surgery is performed in a water environment. There's no air contact with the surgical site. In my opinion, less air contact means less scar tissue. And it's really the same concept and technology as an arthroscopic knee or shoulder surgery, which has been around for ages. Well, you want to see how it's done? Here's an example of a cervical 5/6 herniation. On the left, we can see the sagittal view, or the vertebrae all stacked on top of each other, looking at it from the side. And on the right is the axial view. So imagine that you're standing up and you have a camera maybe on the ceiling aiming down on you and looking at this disc. And the red arrow is pointing to the lighter gray disc herniation, which is large and pushing into that foraminal canal. Well, here's where German engineering and optics are really at their best. On the top picture, we see the disc herniation noted above in the previous slide, and we can see where the scope would be placed through the back of the neck, and with just a very small amount of bone is between the scope, and the disc herniation. On the bottom, we can just see the scope in position to do a cervical discectomy endoscopically. And really, as we're going to see here, only a little bone removal is necessary to see your disc herniation. So on the top slide, the red circle is the disc herniation, and pushing into the foraminal canal, which is located just below it. And the green is representing the bone that would have to be removed in order to see the disc herniation. And we're just talking about a few millimeters, actually fairly small amount, but not enough to destabilize anything. And remember, being performed under a water environment, that scar tissue formation is at a minimum. Well, let's take a look and see what a disc removal actually looks like endoscopically. Okay, in this situation, we're looking at the exiting nerve root going down toward the 6 o'clock direction. The spinal cord is between, say, 2 o'clock and maybe 11 o'clock, and the foot is to the right. So there is a little dissector, and it's being pushed into the herniated disc, or the disc space where the herniation is located. You can see that the nerve root is irritated by the erythema, the extra vessels on top of it, just showing some extra inflammation of the nerve root. The disc, as you can see, is not just something that just pops right out. It has to be teased away a little bit from the tissues that cover it. There's a posterior longitudinal ligament that's on top of it that keeps it, but you can see it's starting to pop up now. I'm just starting to get underneath it and starting to actually lift it out of its herniated position. As you notice, it's difficult to mobilize the nerve root, much more difficult than in the lumbar area, so some care has to be taken and very gently just tease and pull the soft tissues away so that the herniation can become a little bit more prominent, obvious, so that a grasper can be utilized. Anyway, the feet are to the right, head is to the left, and the nerve root is heading down toward the shoulder, arm, and hand. Here's a grasper. Now you see the disc herniation is coming up, and I can start to use a little grasper to start to pull it away, and you can see the little fragments that will be coming forth. It's just a matter of teasing away and then putting the grasper in and starting to pull it out. But you can see how small this is. That's a 2 or 3 millimeter basket forceps or grasper, and you can see that the little disc herniation is coming out in pieces and fragments. There it is, and this is what's necessary. And here is a person who had a endoscopic discectomy, and let's see what he's got to say.
I had suffered some sort of pinched nerve, or wasn't sure, in my neck around the holidays. I'd had problems for years of just a little bit of streaking pain, and but it would go away, come and go. This time it really locked up. The pain was debilitating, severe, living on the couch at home, living on any pain medicine that I could get. I'd never had this sort of pain before, tried chiropractor, and that I saw immediately that was not going to help, so started looking at other ways. We got recommended to one of the big orthopedic groups here in our area, and went and visited, got my MRI. They immediately recommended a fusion, and I just accepted. I was like, wow, okay, must be really bad. I don't know how to read an MRI or anything, so I just assumed that a fusion was a common thing, and that's what I was going to get, a fusion in my cervical spine, and I just accepted that. But then I started doing a little research online while we were waiting for the surgery. We had made a date, and then asked the orthopedic surgeon about other methods, and I don't know if you want me to say this. He said they were a scam. So you want me to repeat that?
Sure, no, it's okay.
So when I called my doctor about some of the other methods, laser and these different commercials and things, and he said they're all a scam. If it sounds too good to be true, it is. And I just went, wow, okay, it's a scam. But as I looked into it and started looking at some of the boards and things, people who had other methods other than a fusion, I somehow found Dr. Mork's information, got him my MRI, he analyzed it, and immediately said, no, we can just go in and clean that up, and you'll be fine. And I was like, really? So, and his experience as orthoscopic surgery of shoulders and knees, I've had a meniscus tear before and had that fixed. It made sense to me that, wow, if we can just fix the problem, then let's fix that and not do this radical fusion thing. I saw some scary videos online with bolts coming loose after a certain amount of time, the limited range of motion, the fact that it might even not solve my pain at all. So it was kind of scary, and I just felt completely at ease with Dr. Mork. And we scheduled the surgery, had the surgery. I had no pain the next day, literally none. I had range of motion, which he told me, don't do, take my time, let it heal. There's about a 6-week process, but I'm 4 weeks now from surgery. I have no pain whatsoever. And I couldn't be happier that I did a little bit of research and found an alternate way to take care of everything. So I'm just super happy. Couldn't be happier. I highly recommend Dr. Mork. Just a super guy. Even when we got to the hospital, everyone that we talked to, nurses from the actually receptionist, said, "Oh, you're with Dr. Mork. You're in great hands." And I truly believe that, and I'm not getting paid to say that. So do your research, no matter what it is, and make sure you don't overdo something. You wouldn't get a knee replacement if you had a meniscus tear, so it just made perfect sense, and I'm just so happy that I came to Dr. Mork. One issue I have with Dr. Mork, you normally, when you have a spine surgery, you would assume you get a lot of sympathy from people. Just don't show them your scar, because it's basically about the size of a pimple or so now, and people don't even believe that I had spine surgery. So that's the only thing I think Dr. Mork may consider making huge, like a fake scar maybe for that we could apply for our friends. But other than that, it's fantastic. So thanks.
Well, the benefits: no fusion or artificial disc, no adjacent disc disease, no instability issues. There's no air contact with the surgery site since it's performed in a water environment. Minimal soft tissue injury is with an 8mm tube, which is just about the size of a straw. Infection rate less than 0.5%. Minimal blood loss is usually around 1 to 3 cc's, barely a teaspoonful. And incision is 3/8 to 1/2 inch. Also, no physical therapy necessary. And one thing I've always said is that in spine surgery, less is better. Well, why doesn't everybody do this if it's so great? Well, I find that most fellowship-trained spine surgeons have very little or no arthroscopic training. They went immediately from their residency, where they may have done some arthroscopies, to a fellowship in which no arthroscopy was done or recommended or part of the program. So it's not really taught in any training programs. Also, the learning curve is steep. This is not a beginner's type of a procedure, and it's not something you can take a weekend course and go home and do. It takes a lot of practice. And last of all, the equipment is expensive. It's the best Germany has to offer. The optics and the equipment, burrs, they're the best.
I hope this gave you some further insight into the treatment of cervical disc herniations with the endoscopic approach. If you have any further questions or would like a free complimentary MRI review, call the office or visit my website now. Get the pain relief you're looking for. Thanks for watching.